Welcome to the And Why speaker series with physicians. I'm Varun Burma, internal medicine hospitalist and one of the co-founders of And Wise. If you haven't already, please go to joinandwise.com to sign up. All verified medical students, residents, and physicians will be able to join our private Slack community. We're really on a mission to provide physicians with free financial education to improve their financial lives. So today, as part of our speaker series, we have Dr. Erkeda DeRouen, and she is a board certified family physician, podcast host, an author, an entrepreneur, and we're so excited to have her.
Thank you so much for having me. And I'm super excited for us to have this conversation about finding yourself in medicine because I think that it's a topic that a lot of people may find themselves thinking about, especially as they are in different states of transition or just kind of reflecting on life after the pandemic. So, I am from the DC metro area. I'm triple board certified in family, diversity, and lifestyle medicine. I'm a consultant, author, baker, and I just am very passionate about working to break the healthcare barriers and make healthcare tech more attainable and diverse. And I'm also the founder of the Pacemakers. So today we will be discussing the landscape of just physicians and where they are in terms of the healthcare system. Talk a little bit about seeking purpose and creating your own unique path, as well as translating skills and negotiating your worth. So, over the years, media has portrayed physicians in very different lights. You can see some of these examples here on the slide deck where we talk about things that seem like Dr. Adam Brickner on The Love Boat or Dr. Quinn Medicine Woman or Doogie Howser or the cast of MASH or the original cast of Grey's Anatomy. I'm not really staying up to date with that and Scrubs. So a lot of people may have had this illusion that practicing medicine may be like it is on TV. Or another reason that you may have gone into medicine may be because you may have been inspired by a loved one, a parent, another relative, a mentor, or had a personal life experience that may have driven you to this act of service. So you made it through and you did it. You did the medical school applications. You went through the trials and tribulations of medical school. You had an endless blur of residency. And now you're working in the field of your dreams. For a lot of people, that's the end goal. And that is okay. If you're content in practicing medicine, that is what the goal should be for some people. But for others, they may not feel like they're in Kansas anymore. In 2022, 53% of physicians reported burnout. Amongst them, emergency medicine specialists had the highest rate at 65%, according to Medscape's latest report on physician burnout and depression. We may be thinking about what may be causing things like this. So there are many causes of burnout, and it can mean something different for every person. But some of the key things that we can think about are family responsibilities may change. You may have started your profession without any children, and now you may have three of them, and you're working to juggle the responsibilities of working your shifts as well as finding daycare or nannies or having more responsibilities with taking care of ailing parents. Or there may have been life changes in terms of going through a divorce and now having more responsibilities that were previously shared. Having the EHR responsibilities, we are all under the pressure of utilizing technology in healthcare. Although some of the technology may not be as up to date, all of the extra access that patients have may cause some issues of staying up all night and completing notes or working on the weekends or your off days or while you're on vacation, just trying to stay breast of your inbox. The low control of the pace. Medicine happens quickly. So you may have to go from running a code to going and talking to someone about their well child visits, or going from one thing to the next, or having a new shift in the responsibilities of the clinic or your team. There's chaos all the time. And as you grow and evolve, this may not always be your goal of what you see yourself as, or what you thought it was when you were watching those TV shows, or your mentors in medicine. And then there's always the time pressure. So there's never enough time. You may have constrained time with your patients. You may have constrained time with balancing your work and your life, making it to your children's events and things like that. So it may cause some type of disdain or regret. And a lot of times physicians may feel guilt because of those things. This was a great tweet that I borrowed from someone where it's just talking about being okay with being human. So we need to normalize doctors taking breaks, normalize doctors drinking water and going to the bathroom, normalize eating in peace and not in front of a computer, normalize crying, normalize doctors taking the day off to rest and reset. Just normalize being human, because a lot of times doctors may feel guilt about each and every one of these things. They may not want to take a break because the patients are coming in continuously. We don't always nourish ourselves in the way that we recommend nourishing others. And we know that things can happen when we don't do that. For example, I have a physician friend who unfortunately was not taking care of themselves when they were working a lot, and they actually had urinary retention. And instead of going to the hospital, they were on the point of catheterizing themselves, but they didn't do that because they didn't have any catheters in the office. That's the only reason. And when they went to the hospital, they had a severe medical condition, and they were actually hospitalized for about 6 weeks. So you have to take this time and care for yourself in order to care for others. And when you think about that, it may lead you to kind of thinking about how to find your purpose. We remember when we chatted about the reasons people may have gone into medicine. It may have been due to the influence of someone near and dear to them. It may have been due to a mentor. It may have been due to you having your own personal life experiences and you being positively impacted and you wanting to positively impact others. So it's a lot of times when you're sitting and you're reflecting about what your purpose is in medicine, it may evolve. And it's okay to sit and find your why, thinking about what you wrote on that personal statement, why you still want to help people. Because more than likely, the urge is still there, but those feelings that accompany burnout may be quieting it. So, some things that you can think about are what brings you joy in medicine, reflecting on those values and interests and things out there, recognizing and addressing the barriers that are prohibiting this joy. So, whether or not it be administrative burdens, work life balance, and how can you fix those? And then thinking about strategies for incorporating joy into your work, such as finding little things throughout the day, such as a meaningful patient interaction or pursuing hobbies outside of medicine, and recognizing that it's okay for you to make your own path. Traditional medicine has historically encouraged two paths, either academia or private practice. Now corporations are coming and working with many organizations, and sometimes doctors are honestly feeling like some of their autonomy is being taken away. They change payment structure sometime, they change opportunities for growth, scheduling, or may require supervision of physician extenders. And sometimes it's okay to realize that it may be time to create your own path. There are so many different opportunities and ways that physicians can work together And a lot of colleagues just sometimes feel as though they want to transition, but they don't necessarily know how. So it's okay to sit in being afraid and sit in being uncomfortable and figure out ways to create your own path. And with that, the possibilities are endless. A lot of times, physicians may think that they've trained for so long on different specialties where they only know how to be a surgeon, they only know how to be an OBGYN, they only know how to practice primary care, they only know about anesthesia, they only know about hospital medicine. But we must realize that a lot of skills are transferable. So the things that you can do and the knowledge that you've gained over time is valuable, and it can be kind of adjusted to many different fields. Here on this slide, I list several, but honestly, there are so many more potential career opportunities for physicians if you're looking to make a change outside of the one on one patient interaction. So, there are things that range from becoming a medical writer and utilizing your skill sets in the way that you've developed writing to contribute to other organizations, being a medical science liaison for pharmaceutical companies, working as a medical product manager for some of the up and coming startup and technology companies, working as a health insurance analyst, becoming a billing and coding specialist for some of the newer companies that are coming out. And having that perspective as a physician is very valuable in some of these fields. But as you think about potentials for transition, sometimes imposter syndrome can hit you. As many physicians think about finding a new space for themselves, they may feel like they're not equipped to do so. You may feel like you don't know enough about a topic or anything to be considered a subject matter expert. You may feel like others in your specific industry know tons more than you do, and you can't possibly contribute to a role. And you may feel like you don't necessarily deserve, even sometimes, a promotion, such as being promoted to chair of the department because you didn't put enough time in. There are so many reasons to think about why it would not work out for you, but it may be time when you're sitting and you're thinking to talk to yourself and just reframe that thinking into why wouldn't it work? Or instead of what if it doesn't work out, what if it does? So, with that, we seem to think about and take a step back and think about what can you contribute, especially if it's outside of what you've been doing for since residency or for the past 5 years. There are so many transferable skills in medicine that you may not even think about. Things like medical knowledge. A lot of organizations do not know or have the insight as to what it's like to have that physiology background in terms of how things work. You may want to collaborate with medical device companies and help them grow. You have these clinical skills. You have the ability to communicate. You have the ability to take information that is complex and present it in a way that is understandable. You're able to think critically. You're able to manage teams. Even if you have not necessarily been in a leadership role, you've managed working with medical students, you've managed working with teams on the wards with nurses and pharmacists and a lot of the other administrators and things that work on the team. So you are a leader. You have the ability to make decisions while under pressure. You have interpersonal skills because you've interacted with so many different people throughout the day. And you have the ability to teach and mentor, experience most likely with some form of research. So, a lot of these skills that you may not think that you have when you're looking for jobs are actually there. It's just about reframing your thinking to set and align your purpose or your goal with what you can do. So, here's a little bit more about me now that we're friends. So, I was born to teenage parents in the inner city. I'm a first generation college student. I went to Hampton University and Boston University for medical school and the University of Maryland for family medicine residency. And although I thought I would dedicate my life to the underserved, I worked in all of the undercity hospitals and actually had decided to go and work with the federally qualified health centers with the National Health Service Corps, I realized things can change. So sometimes we sit and we think about what opportunities there are out there to engage with patients. So I loved working one on one with my patients who, at my particular clinic, 50% of my patients were undocumented, 50% of them were uninsured. It was an LGBT based clinic. So there were a lot of patients who were coming in with very big need for support. But my life kind of turned around when our organization came to the clinic and they wanted to change the compensation model. And they wanted to start triple booking us for patients, not double booking, but triple booking. So if you had a 15-minute slot, divide that into three, including rooming the patient and all of those things. So instead of people deciding to quit their jobs or to just do it, our team decided to unionize. And I was elected to lead the unionization efforts for 18 months as the sole physician rep for 5 clinics. So it allowed me to become very well versed in contract negotiation as well as interacting with the C suite to advocate for physicians. So this definitely changed my frame of thinking amongst being led to do versus helping advocate for physicians to use their voice. And since then, I decided to transition to telemedicine before it was cool. So about 5 years ago, I transitioned to telehealth and have served in various leadership roles over time. And I started serving on several mission oriented boards, including some for the underserved populations and some in tech oriented roles. Started speaking professionally and hosting a podcast that's now ranked in the top 2% of its niche towards medical students. And this has definitely allowed me to look and find other opportunities for growth, including authorship, where one, I talked about overcoming some of those adversities that I experienced in my youth, as well as one where we talked about navigating telehealth for patients published by the Mayo Clinic. And I also launched a health technology consulting firm where my team helps clinicians and companies find their niche, develop business plans, and find funding. So that led me to give a TEDx talk where we discussed how to utilize the Disney Imagineering method to implement that into healthcare, which has been viewed by over 100,000 people, which inspired me to lead and launch the Pacemakers based off of that TEDx to change health equity and the healthcare landscape. So I'm not saying all of that for bragging right and all of those things, but I just wanted to give you a little insight into how it's possible to find ways to utilize your skill sets in your niche and utilize your medical training and your life experiences to create the impact that you want to do to promote and kind of build off of your values and your ethics. So initially, I did want to stay in traditional primary care, working in a QHC, hopefully for 30 years. But life had other plans. So it's okay as you hit different barriers and bumps in the road to figure out that the journey may not be a straight path, and that's okay, but it can be fun and it can lead you to other things. And it's okay to explore those and not tell yourself no before others do. So, with that, I just want you guys to take some time to reflect and breathe and pause if you're watching this on replay and write down to do this later if you're watching this live. So, some things I want you guys to consider are to try to think about what you're going through if you're feeling like you're having sensations of burnout and try to figure out what that cause is or why you want to make a change. Burnout can have many causes, like we talked about, like long hours, high workloads, administrative burdens, lack of control over patient care. But you can identify those specific factors that are contributing to your burnout and consider whether or not a career change would address those issues. Or maybe it's just taking some time off for yourself taking a little sabbatical, going on vacation, taking some me time, even taking a 3-day weekend can sometimes help people regroup and maybe go to the spa or out to dinner. Consider your values and priorities. So reflect on your personal and professional values. Consider whether or not your current career is aligned with those values and whether or not a career change may help align with your priorities. For example, if you're working in a place where you may not have as big an impact on underserved communities, and that's why you enter medicine, you may, number one, find a clinic where they have underserved communities and work there versus go and volunteer if you want to go and volunteer at a homeless shelter or give your time or create an organization like I did where we're going to work to address the social determinants of health. So the possibilities are endless. You can explore alternative career paths. If you're considering a change, you can kind of talk with other people and think about your strengths and weaknesses, even utilizing the list that I gave earlier with all of the different options out there. You can also take a step back and think about those financial impacts because there are pluses and minuses, and some specialties make more money. You have to figure out what is of value to you, and is your time or your mental health more valuable than the financial trade-off that you're giving for your work. And then seek support. It's okay to speak to a counselor. It's okay to get a coach. It's okay to talk to your colleagues and see if they're experiencing the same thing because you would be surprised a lot of people are. And while you're doing that, consider self care strategies because even if you decide that it's okay, you're going to make that change. Sometimes it takes a while to transition. So you have to continue to practice mindfulness, continue to exercise, continue to engage in hobbies that make you you. Now, when you are deciding that you want to transition, it may be a good time to see what's out there. So you can check on various modalities. You can look in LinkedIn, Indeed. You can check your local specialty journals or the direct sites of potential employers, which is sometimes honestly the best way to look because if you apply online through their site, they may visualize it sooner. One thing I would say is to make sure that your CV or resume is up to date and realize that if you are trying to transition to some other industries, they may require a resume. And a lot of people who are in the medical field typically use a CV. So you may want to create one yourself or have a professional create it for you to translate some of the things that you may not need on an actual resume. Then after that, you need to network. So optimize your LinkedIn. Make sure that your LinkedIn page matches your skill sets and your values. Make sure there's a picture in a banner because I know a lot of physicians do not maximize their LinkedIn. And if you have a picture, it makes you seem more credible and people won't pick your butt. Highlight your accomplishments because this on LinkedIn is a visual resume for many people. So you can utilize it to showcase what you're doing, what research you're doing, what conferences you're presenting at, what organizations you are involved in, and it can give people a better picture outside of what's on your written resume. You can follow companies and kind of engage with what those employees in those companies that may be of interest to you and connect with them because you may be able to have a virtual coffee with them and decide and discuss whether or not there's any synergy or if there are any opportunities that may be coming forward that may not even be listed on LinkedIn or these other sites. You can also reach out to your network. So your network is your net worth. So connect, ask questions. You may be surprised about people who may know opportunities that are out there, people who may know other physicians who are working in an industry you are interested in getting involved in, as well as talking to them about things that may be taboo, like salaries, because a lot of times there are discrepancies there. So it's a good idea to kind of talk to those who may be in the industry already to know what to even ask for. Another thing that I want to mention is that if you don't see your job out there that you may want, it's okay to create that dream job. So we're living in revolutionary, technologically advanced times. and the industry needs your expertise to innovate. So don't let the lack of, if you don't have a formal business training or an MBA, stop you. Because as we've discussed, you had a lot of transferable skills. So you can partner with individuals with more business acumen than you. So also don't let that lack of capital scare you as well, because there are so many funding opportunities out there. So once you found your dream job, even if you're at the point where you are moving to your first job, moving from residency to your first employed job, or you're transitioning from a job you've been at a while, you may not have seen a contract in a while. So contracts are so important because if it's not written, it doesn't matter what they said on the phone call with the recruiter, not happening. So I would recommend that you please get a reputable physician contract lawyer to review your contract. Even if your organization has told you that it's non negotiable and things like that, yes, that is a red flag. Most things are negotiable, but it's important to get a lawyer that's well versed in physician contracts because all employment contracts are not created equal and there may be some nuances. Here, I'm just going to tell you a few potential red flags to look out for. Non compete clauses. These are clauses that restrict your ability to work for a competitor or start your own practice for a certain period of time after leaving the job. You have to make sure that you understand terms of any non compete clause because some are predatory. It kind of takes away your autonomy to work and to leave, even if you're unsatisfied, because they may have restrictions of 50 miles, meaning you may have to move in order to leave the job. I've seen some in the tech industry who've said the entire world, which obviously is not enforceable, but it costs money to fight these things once you've signed it. So it would be a great idea to advocate and have these removed. There is some legislation being proposed to remove and nullify non-competes, but it's not as specific as if physicians are included. So it would be also a great time for you guys to advocate to include physicians in these types of legislation. One other thing you think about is compensation structure. Make sure that your compensation structure is clearly spelled out and you fully understand how you'll be paid. Pay close attention to any clauses that may affect you, such as bonuses or productivity incentives, because those are related, things that are related to patient satisfaction scores or performance metrics, letting them know what they are. If you decide to enter the startup world, things are fast paced and they may change rapidly. So making sure that you have an idea in writing about what it is and discussing that thoroughly is important. Termination clauses are important, looking at the termination and how much time you have to give notice and how much time the employer must give, because that can get tricky. If you were to leave earlier or if they had a long term in terms of you transitioning to get another job. Your liability and malpractice and tail coverage is very important to see who'll cover those types of things. Of course, your workload and your schedule, making sure that it's doable. The supervision of mid-level. So some jobs may require you to supervise physician extenders. And if this is something you have to ask if you're okay with in terms of adding that liability to your licensure. And if yes, what type of oversight and compensation will accompany that? As well as your benefits and perks. So there are so many benefits out there from health insurance, retirement, and the common things PTO. But newer packages include things like funds for well-being or fertility coverage. So please make sure that your package is competitive, especially if you're entering a new industry. Intellectual property things. So if you're transitioning to something that maybe with technology or medical devices or pharmaceutical companies, making sure that your contract includes clauses related to the things that you may have rights to in terms of your research or inventions or your skills that you develop while working for the employer. So there are many things to look out for when you are signing a contract that if you catch it early enough with a great lawyer can save you a lot of stress in the future. Analyze will also have some AI assisted technology to help you review your contract as well. So that's something else to explore. In terms of negotiation, when you get the contract, if it's not what you really like, or just in general, negotiation is something that's often feared. But in actuality is the most beneficial thing you can do. There are some things that can be negotiable, but I like to say that most things can be negotiable if you're a good fit. Things like salary, benefits, vacation time, work schedule, job responsibility, title, even can make a big difference in terms of your career progression and relocation expenses, signing bonuses, education, training, or even opportunities for professional development. I have a little mnemonic negotiation that you can think about in terms of the key things to talk about when you are negotiating. Looking at your needs and identifying what your needs are and the needs of the other party. Your expectations, clarifying your expectations and the goals of the negotiation. So, your goal is for you to start this job and for you guys to be on the same page. What ground rules are. So, establishing what they are for a negotiation, such as who is the key point of contact for you to talk with? And what is your communication modality? Will you meet on Zoom? Will you meet in person? Will you email? Always follow up conversations that are verbal with an email to make sure things are in writing. Options, brainstorming those options and alternatives that can meet both parties' needs. Trade offs. So, what things are you okay with compromising to reach an agreement? Because both parties will likely need to compromise. Interests, understanding the interests, motivators, and concerns of both parties. Because, of course, a lot of organizations, of course, want things to be comparable amongst their employees. So, figuring out how to meet them there, but also keeping your best interests in mind. Alternatives, thinking about alternative solutions if you can't come to an agreement. So, they may not allow you to have more weeks of PTO, but they might let you have more CME days or CME money to go and learn and bring that back to the company. Take action. So deciding on your course of action and the steps to implement it. And then evaluating. So always going and having that lawyer check it and make sure that it's sound before you sign something that'll be in effect for years. I'm not a negotiation guru, but there are some people who have lots of things to discuss about this. So there are many guides and resources as to how to negotiate for and ask for your work, but I definitely recommend starting here. The first book, Never Split the Difference, is from an FBI agent who talks about the rules of negotiation engagement, and they're quite applicable to healthcare. You wouldn't really think being an FBI agent out in the streets would be the same, but it's very similar in the boardroom. The next book, Power Moves, is by Dr. Bonnie Simpson Mason, and she has key tips geared toward physician contracts. This is very unique. She talks a lot about the basics and things that you would need in order to negotiate what should be included in the contract. And this is mostly geared towards traditional physician contracts, but I think that is something that everyone needs to read, especially if you're in the earlier stages of your career, transitioning from residency or in one of your first few jobs. It's very great information. The next one is Getting to Yes, Negotiating Without Giving In. So these are by two Harvard big name negotiators that teach tactical ways in which you can get to yes via step by step strategy for coming up with mutually acceptable agreements in every sort of conflicts. And the last one is my personal favorite, Ask for More 10 Questions to Negotiate Everything. This is a Columbia law professor and mediation expert who gives a straightforward, accessible approach to anyone who can ask for and receive more. She also has a great social media channel via her LinkedIn and in her Instagram, where she definitely helps people figure out negotiation tips. Of course, there are other books, podcasts, social media influencers, and the like. It's also great to chat with your colleagues as well And of course, your lawyer should be able to assist with your negotiation, whether or not they negotiate directly with the organization or they can give you key points and tips and highlights as to what you should ask. So, congratulations, you did it. You reflected and you found your purpose. You searched and you found a great fit. You networked, reviewed, and you negotiated a great contract. Now you're in your dream job. If there wasn't one out there, you're starting to plan to pivot and figuring out how to line your ducks in a row in something that's self directed, such as starting your own DPC, your private practice, joining a startup, starting your own startup. If you need help with starting your own, you can always reach out to my team and my consultancy via LinkedIn at Erkeda DeRouen so that we can do an intake and see if your idea is a good fit or refer you elsewhere. I'm not trying to sell myself. I love helping people start and grow, but I also love the one on one touch. If we're not a good fit, we can definitely help you figure out what's next. I just want you guys to remember that finding yourself in medicine is all about being true to yourself. You are enough. You are worthy. You are capable. You are knowledgeable. Sometimes finding yourself is as simple as setting boundaries and taking time off to prioritize yourself while enjoying some of the things that make you you. While other times it may mean leaving everything that you know to try something new. I just want you to know that there are so many other physicians who are feeling the exact same thing that you felt. And we want to build this community where you have the resources to help figure out how to make your life a better you and how to create a future that you want. So I just want to thank you guys for brainstorming with me over how you can transition to the best physician career that you could possibly have. And that's all from me.
Thank you. Thank you so much for that talk. It just resonated with a lot of stuff that you said. So thank you, Dr. Durone. For anyone that hasn't joined yet, please go to joinandwise.com where you can get verified and join our private physician community and also receive access to financial planning tools that you would only have access through if you employed a financial planner. And we have lots of other exciting stuff coming. So thanks again, everyone. Bye bye.